Hi, everyone. Welcome to our webinar today. I know that people are just coming in, so we will start in a minute or two. Okay, why don't we begin? So welcome, everyone. You have joined From Blueprints to Breaking Ground, Capital Planning for Health Center Growth. Today is session 2 of a 3-part series, and we will be talking about capital sourcing. Okay, so as I mentioned, this is the second of 3 sessions that we are providing to talk about, really provide an overview of the process and key considerations before you embark on a capital project. So in October, we had our first session where we spoke about goal setting and project planning. If you missed that, we will send a link to the recording in our follow-up from today's session, as well as a recording of today's session. So you will have both that you can look at. I will also provide a brief overview in a little bit. Today, however, we will be spending lots of time talking about capital sourcing and how you might fund your capital project. And then next month, on December 11th, we will be talking about project implementation and some lessons learned. Okay, so a little bit about us. Primary Care Development Corporation puts health equity and access as its core mission. For the last 30 years, PCDC has provided consulting, financing, and advocacy to enhance access to primary care in the communities that need it most. In our 30-year history, we've leveraged more than $1.7 billion on health center projects nationwide, and we've helped over 1,300 practices transform into medical homes. Our investment team works with borrowers to craft financing solutions that work for them. And our consulting and training team partners in health centers and primary care practices to transform and sustain their operations by optimizing care models and strengthening their financial health. This is Maya Morse. I'm from the consulting and training team, and I joined PCDC about 12 years ago, and I focus on leading quality improvement efforts in a variety of settings. I'm joined today by my colleagues, Rachel House and Nancy Lager. Rachel is a senior project manager on the consulting and training team. She joined PCDC in 2022 to support and expand our financial management and consulting services and provide some program development. Nancy is a senior director on the capital investment team. She joined PCDC over 20 years ago and has advised health centers nationwide on project development and financing. Okay, next slide. Today, we are going to talk about really a deep dive into the fundamentals of funding a capital project, including determining the financial feasibility and different sources of capital for your project. Then we'll discuss some various loan eligibility requirements and how you can estimate your debt capacity. Next slide. So for the agenda, we are going to start with a bit of a recap on the pre-project analysis and project planning. That's really what we focused on in our previous session. And then we're going to jump right into project funding, looking at some different sources of capital and some financing considerations. And then preparing for financing, some quantitative and qualitative considerations, estimating your debt capacity, and we'll actually provide a case study with some sample calculations. Slide. So you may have remember this graphic from our first session if you were there. So this is basically our 5 steps to capital planning. Or planning a capital project. And so in our first session, we actually started out with strategic planning and pre-project analysis, and we also looked at project planning. Today, as you can see in yellow, we are going to focus on project funding. which is really important before you get to the last part, which is project design and closing and construction, which we will talk about in our third session. All right, next slide. So during the first session, we spoke about conducting a pre-project analysis. This includes doing some strategic planning to identify your organization's short, medium, and long-term goals. Specifically, it's really important to identify if the organization is anticipating growth or some sort of increased demand in patient care that you won't be able to accommodate with your existing resources. We really encourage organizations to use external community-focused needs assessments to help inform this planning project. You can also do an internal assessment, and this might include an operational assessment of your productivity, your staffing model, your financial health, and looking at some access to care metrics. And if you determine that you're unable to accommodate your current or your future demand for care, it's a great idea to consider some alternative options for care delivery, such as including possible expansion, relocation of your practice, and the acquisition of some local practices. And there's different strategies for doing that. We're happy to share more about that. Within the project planning, we suggest that organizations develop a clear work plan and identify a diverse internal and external project team to help inform this planning process, as it's really important. This really sets the foundation for all of your future work within that capital project. This team will need to carefully review the organization's budget and outline a clear project and space plan. And as I mentioned, for those of you that missed the first session, we will provide the recording so that you have access to both recordings at the end of today. Okay, and now I will transition to my colleague, Rachel House, who will jump right in on project budget and the business plan.
Thank you, Maya. So as we mentioned in the first session and Maya just discussed, project planning is iterative. So as you move through this process, you will want to increase your specificity and detail around the analysis. So Maya just covered a lot of information that we would recommend you look at prior to embarking on a project. But once you have made that decision and you're moving forward, you will leverage all of that analysis and create a project budget, a refined project budget and business plan. So for the business plan, we've included a helpful resource from Capital Link, which can kind of walk you through the process. But the business plan is really focused on translating your strategic plan and your analysis into action steps. And it's very specific. So it'll include components such as the project narrative, which will detail sort of the 5+1 questions, which is who, what, where, when, why, and how much. So you want to get very specific about what the project is, why you are pursuing this project, and how much it will cost. You will also have a corporate narrative component, which will include a management overview, the historical view of the organization, and projected financial performance. And the audience for this is really both internal stakeholders, so for your board and other stakeholders, as well as external stakeholders, which we will talk a little bit more about today. And additionally, your project budget will be more specific as you get farther along in the process and you are preparing to look for funding. So you'll want to get very specific about the property acquisition, construction costs, details around permitting and other fees. So you will be engaging with a construction company in order to get a lot of this information. So as you pursue and move through the process, it will get more specific. Next slide. So we've discussed, as Maya mentioned, the planning phases of capital projects, and now we're going to focus today's session on project funding. So this is really how you're going to pay for the project. And it's never too soon to start thinking about how you'll fund your project. And understanding the different funding parameters can help preserve your options. So knowing that some funding is place limited can help inform site selection, for example. So it's important to look at your options early, and we'll be talking about those in detail today. Next slide. So before we dive into the different sources of project funding, we'd like to get a sense of what funding sources you have used on a previous project or sources that you are planning to use for upcoming projects. And select all that apply. Okay, we've got a lot of good answers coming in. Okay, so as we can see, a lot of folks, 88% are planning to use some cash operating reserves as well as grants. Those are the largest. Capital campaign fundraising, about 25%. 63% are looking to use long-term debt financing. And then around 20%, 19, 20% new market tax credits. And then we have a few others. So everyone is kind of all over the board, but lots of cash and grants, which is great. So thank you for that. And we'll go to the next slide. Great. So again, as you're considering funding sources for your project, it's important to evaluate the pros and cons of the different funding options, which we will discuss in detail today, and consider what options are available to you for your project. You can also consider your debt capacity, and so we'll walk through some examples of how to calculate this. And finally, you'll start raising funds. Next slide. So in its simplest form, there are really three ways to fund your project: cash, debt, or a combination of cash and debt. So by cash, we mean savings or surplus of funds that the organization has accumulated from positive operating margins or investments. And it also includes fundraising and grants, which you can raise through a capital campaign. Debt will be loans and financing, which you can borrow from various sources, and then you will have to pay that back over time. And then most organizations typically use a combination of both. Next slide. So we want to just take a moment to talk about building cash reserves. So this is something we highly recommend your organization works towards building your cash reserves. And this is a process that can take time, so it's not something that you can achieve overnight. But establishing a healthy operating margin increases the amount of cash that is available for projects and also is beneficial for ensuring that the organization is on a solid financial position, which can enhance your borrowing capacity. So it's beneficial both to have cash to put towards your project as well as if you are looking to take out a loan. So a couple ways we want to just highlight when you're thinking about increasing your margin. So really it's focusing on maximizing your revenue generation and then managing your expense. So in order to maximize revenue generation, as we touched on in the last session, you want to ensure you have strong operations and productivity, so you're generating revenue, and then having really effective revenue cycle practices and ensuring strong revenue cycle management. So it's critical for your health center to review your revenue cycle metrics on a regular basis to ensure you are collecting all the money that you have earned and are owed, right? And this process begins at the front desk and requires a team effort to ensure that all staff are contributing to sending out clean claims in a timely manner to make sure you're billing and receiving all the money that you can and are owed. And finally, also looking at quality improvement incentives and other forms of revenue that you may be eligible for. And then managing your expenses is also critical. Um, as we know, with wage increases and competition for staffing, this can be very challenging. But we do recommend that you review your expenses and your contracts. Um, I've worked with clients who, upon closer examination, realized that they were overpaying a contractor, or by switching to a new vendor, they saved a significant amount on vaccines. So it is still possible to look for savings when you do a detailed review of your expenses. So we recommend both of those things. And then again, planning for the long term, both in the beginning of your project and throughout the project life cycle, because you'll want to maintain strong operating margins through the project life cycle. Next slide. So now I'll pass it over to my colleague Nancy, and she'll talk us through some details of sources of capital.
Thank you, Rachel, and Maya. So I think in the previous slide, Rachel did touch on all of these kinds of sources. Obviously, the cash ones being savings and grant and fundraising, and the debt options being everything from commercial financing to tax credit financing. We've tried to provide some of the pros and cons that we see of each source, and highlighted in green are some of the factors that differentiate the debt sources. As I mentioned in the first webinar, there are 3 watchwords that we'd like you to take away from all of these presentations. Those are sustainability, realism, and flexibility. Obviously, Rachel in the last slide talking about how to make sure your cash is growing and safe, and that you are obtaining the largest surpluses you can. That really goes towards sustainability of the organization, but also towards your ability to take on a capital project or any kind of programmatic growth that you are looking to accomplish. So really, in planning for and determining how you're going to fund any capital project, you do need to be realistic about the level of growth you can handle, and so what size project makes sense for your organization. You also need, as I mentioned, to focus on sustainability. What kind of funding can your organization afford? And you need to remain flexible. You may need to downsize the project to keep it manageable, and you may need to extend the development timeline if cash is the most sustainable funding source for your organization. So obviously, the cheapest and most flexible source is cash, particularly the cash you've laid aside. And the smaller the project, the easier it is for you to fund it with cash. The larger the project, the more you'll need to consider a combination of funding sources, as it looks like many of you are already considering. At the far right, in terms of tax credit financing, New Markets tax credit financing is the kind that health centers typically use when they're looking for tax credit financing. And it is one of those place-based or place-limited sources that Rachel mentioned. It's also unique among all of these sources in that it provides a 15 to 20% subsidy, which reduces the amount of debt and cash that you would otherwise need to provide for the project. Next slide, please. Why should you consider financing? Obviously, it takes time to set aside those reserves, and fundraising can also take a long time. So again, if this is realistic for your organization, taking on debt can help you accelerate your development timeframe. It also allows you to preserve your cash, which you'll need for ramping up the new operations or expanded operations at the project that you're developing. You really can get the best of both worlds also if there is flexibility in any kind of debt that you take on. Specifically, if the terms allow you to prepay, and preferably to prepay without any kind of penalty, then you are able to prepay principal as you receive additional grants or donations or have cash surpluses. So it buys you some time while you're generating additional cash, or it can, but again, you need to make sure you've built in that flexibility in the loan you're taking on or any kind of debt. Next slide, please. So how do you prepare for financing, and what do lenders look at? We'll talk about here on this slide, what are the kinds of qualitative considerations lenders look at? And what are the next slide, what are the kinds of quantitative considerations they take into account? So the first is really your ability to borrow. And that's really as much a quantitative as a qualitative consideration. So first, though, a lender will look at will the project have an impact? It's really especially important to mission-based lenders like PCDC to know that there is a need for the project, if there's community support for the project, and if it will expand health equity, notably by improving healthcare access and outcomes, especially for low-income persons. That's not true for every lender, but every lender wants to know there'll be an impact, that this is going to generate some kind of change and improvement for the organization. They'll also want to know that the organization is well managed. One of the key ways we assess that is, has management been stable? Or if there's turnover, why? Our management and the board have experience running the kind of organization that you run? And do they have experience managing a capital project? If any of those things, there are deficiencies, then you can supplement to a certain extent. You can certainly supplement your lack of experience in undertaking capital projects by bringing on external team members or having internal staff who have an understanding of and have accomplished capital projects. But the other things, those you need to have intrinsic to your organization. Another key aspect is lenders want to know you're being realistic about the project you're contemplating, both in terms of size, in terms of the timeline for getting it done, and in terms of your ability to fill out all the sources of funding that you will need for the project. Next slide, please. In terms of quantitative considerations, I think this will probably look very familiar to you all. It's, do I have the debt capacity? If you look at your own historical performance, will you be able to secure a loan? And will you have the ability not only to complete the project and ramp it up successfully, but also the ability to sustain your organization over time? So lenders also look at what are the risk mitigants in case anything goes wrong. And you need to be aware of that, and you need to be prepared yourself for what you will do as an organization if something goes wrong. First, really understanding looking backwards though, at your own balance sheet and income statements, lenders will look at those. They'll compare what's happened over several years, and they'll want to understand what's driving the trends they see. If your financials are trending downward, they'll want to know what you are doing now in advance of the project you're contemplating to reverse those trends, not simply relying on the project to make your trends reverse. In an upcoming slide, we'll talk more about what are some of the key financial indicators that lenders consider to determine debt capacity. But I just want to take another second here to say the trends in your expenses versus your revenue, which Rachel previously mentioned as well, really are an indication of how you're managing your operations. And your trends in days cash on hand, days accounts receivable, and accounts payable really demonstrate how you manage your money. So if you're consistently high, for example, in days accounts payable, it could also be treated, not only are you just, delaying your vendors and keeping people at bay, but it may be you're doing that because you have insufficient cash to pay them, which could be a sign that you'll have insufficient cash going forward, or could, to pay back any debt that you take on. Next slide. Thank you. So what are So one other way, though, to shore up your situation well, I should start with, most lenders really will look for some kind of collateral. And where possible, they'll look to secure loans by placing mortgages on the project property or on other property owned by the borrower. That said, repayment is really what's key for most lenders. They want to get paid back. They don't want to foreclose on your property and sell it and lose those resources for their constituents who are often community members. So they may look for another form of security to ensure repayment. This can take the form of a guarantee, say from an affiliated organization who may have stronger financials than your particular organization may have, or it could come in the form of a government grant. I'm sure many of you know, but for those who don't, HRSA has a loan guarantee program that's available, although it's only available to 330 grant-funded health centers, not to lookalikes. But it is a particularly advantageous loan guarantee program. It comes with no cost. There is no cap on how much can be borrowed. It is available from the start of construction, and it can be used with both conventional debt and new market tax credit financing. Just a full disclosure, PCDC is the lender coordinator for the loan guarantee program. So we have a lot of experience with it and know that it is not always necessary. It may be useful. When might it be useful? It might be useful just in convincing your lender to get to a yes and to provide you with a loan. It's that form of credit enhancement, if you will, that a lender may need to know that they will have most, at least, of the loan paid back, even if you are unable to do so. It also might be able to get you better terms. It might enable the lender to provide you with a longer loan term or a longer amortization period. That's the how you pay your loan back, not the term over length of time over which you pay your loan back. It could get you a lower interest rate. It could allow the lender to reach a higher loan to value when they look at the collateral that you have available. So I always say, keep that in your back pocket, talk to your lender first, see what they're able to do. And if you're not able to get to a yes with what they can see, or you hope that there might be some better terms, you can let the lender know then that there is a HRSA loan guarantee potentially available, and that might change their answer from a negative to a positive. Next slide, please. So how do you think about debt capacity? Well, how does a lender think about debt capacity? So as I mentioned, as a starting point, it's always looking historically first. So the key indicators are looking at cash flow, for which EBITDA is often used as a proxy, and that is earnings before interest, depreciation, and amortization. This is calculated as what's my net operating income before taking into account any non-operating income you may achieve. So net operating income plus your interest expense plus your existing depreciation expense, that determines EBITDA. Most lenders then want to know that you can have some minimum, what's called debt service coverage ratio, which means that your EBITDA is X amount in excess of your annual debt service, so that they know that even if things are off by somewhat, you'll still be able to cover your debt service. And that is all of your debt service, not just the loan, the debt service related to the loan they may be making, but any existing debt service on debt you have today. And that can include your lines of credit. So at a minimum, you want to look historically at your own financials and see, can you meet 1.25 times that your debt service coverage historically? And then we'll get into how do you look at it in relation to your future performance. So next slide, please. So this really gives you the sort of graphic of how you examine that. So in this example, we're looking back at the 3 last years of audits. We would, if we were doing this, also look at the year to date. Most of you are in fiscal year 24, although some of you, if you have, as PCDC does, a June 30th fiscal year end, you're in fiscal year 25. So in any case, we're looking back at least 3 years and the year to date. And we're seeing here from this example that this health center, let's look just at 23 for the moment, had $15 million, $15.25 million of revenue, expenses, operating expenses of 15.1, and excluding the interest and depreciation, which are in that $15.1 million, and subtracting that from revenue, they have an EBITDA of 1.16. That's pretty good. Many of you do not have an EBITDA of 1.16, but this health center in fiscal year 23 did very well. And you can see better than fiscal year 22, not as good as fiscal 21. Most of us in fiscal 21 were buoyed by those COVID grants. So this is, you know, the grants winding down in 22 and operations in this case rebounding, and maybe some of the still grants coming out in 23. This health center happens to have $540,000 of debt service right now from existing debt. That is principal and interest payments that they have to pay, or they had to pay in 23. So when I divide that EBITDA of 1.16 million over 542,000, I get a debt service coverage ratio of 2.06, a healthy coverage ratio. As you recall in the last slide, I mentioned we, PCDC and many others, will look for a minimum of 1.25. So, okay, now how do I take this historical picture and assess what my debt capacity might be? One way to do that is to look at what's the average EBITDA over those past 3 years or 3+ years. And then, okay, if my average EBITDA is 1.1, so it's less than what I had last year, but it's, you know, allowing for fluctuations in my bottom line performance. It looks like with an average EBITDA and my existing debt of debt service of 542,000, I would, sorry, I have an existing debt service of 542. Okay, so the maximum annual debt service I can have with a 1.25 debt service coverage ratio and an EBITDA of 1.1 is $887,000. So the difference between what I already have as debt capacity and that maximum, if you will, is 345,000. So it would look like this health center can take on another annual debt service of $345,000 and still meet a debt service coverage ratio of 1.25. Okay, so how much debt does that get me? Next slide, please. So that, to answer that question, it depends. Of course it depends. It depends upon what the interest rate might be of the debt you can take on, you can get from a lender. It'll depend on the term of that loan, and it'll depend on the amortization period. So to the right, we've provided a sample of what that debt could look like if I had 345,000, or I'm solving for $345,000 of additional debt service. This shows you an array of debt loan amounts you could take on at different interest rates and different amortization periods. So it looks like you could borrow from 1.9 million to 4 million. Again, we always suggest that people are realistic and concerned about sustainability. And so you may not want to think you're going up to that maximum 4, but maybe something less than that. But that's where you would be based on your historical performance. Next slide, please. So lenders, though, will also, many, not everyone equally, will look at what's the projected performance of your organization. Partially, it's your projected performance if you never accomplish this project, and then what is the additional add-on by accomplishing this project. So in this example on this slide, we've projected out the performance for 5 years. A lender may want 3 years of projections, 5 years, or 7 years, or the full term of the loan if it's longer than 7 years. And that also depends upon the nature of the financing, how many years of projections the lender will look for. But here, just to be simple, we've provided 5 years. This also assumes that the ramp up of that new project happens pretty much within the first 3 years. And you can see by revenue, it's pretty steady state after that. So we've said in the the fiscal year 23 column, you can see we said you could, based on historicals, take on about $345,000 of additional debt service. And that would translate into a maximum of $4 million that you could borrow. When you look forward and you say, okay, how might that picture look differently if I produce additional revenue from the project and continue to manage my expense growth? So in this example, the blue line says, well, actually, it looks like you might be able to take on an additional annual debt service of $349,000 in year 1, working its way up to $477,000 in the next years. The reason it's different in year 1 is we've allowed for interest only. Most lenders during construction or a ramp-up period will allow for you to have the loan be interest only. And then after that, when you're a little bit more settled, to begin paying principal and interest back for the duration of the loan. So based on that interest and that full principal and interest payment of $477,000, it actually looks like at 7% interest, which I hope is a higher rate than we would provide, that you might be able to actually go up to $5 million of debt. So a little bit, $1 million higher than if we just look at that at your historical performance. I will say I think these projections are very reasonable, conservative even, in not expecting too much growth from year to year based on the project. But you also can test your own reasonableness by looking at what's your historical growth trend look like. Obviously, you want to allow for the project to happen, but you don't want to be extreme. If you've been growing at 2% every year, then your existing services might grow at 2% going forward each year. And then there'll be some bump up for the project, for the additional services and revenue and expenses that the project will bring on. So again, be reasonable. Next slide, please. So how do you then think about funding? You've done a debt capacity analysis of your own. You've come up with this projections, but they're really based on what do I need? What is this project that I'm actually trying to accomplish? So in that project budget that Rachel mentioned earlier, let's say this is what your project budget in those very high categories looks like. You need $1 million and a half to acquire the property that you have your eye on and your heart set on. Based on what you can build on that property, or there's a building, what it will take to renovate that building into a usable health center could take you $6.1 million. You need furniture and equipment to outfit it. And there are professional fees, including the main one being your architect. You have to design that project. So just based on estimating those costs, you at a minimum have an $8.8 million project that you're contemplating. You now start looking at where am I going to find this? What are those sources that I'm going to look to pay for that project? From your cash reserves, you can afford to buy the property, and it looks like you can afford to pay for the architect. So I have 1.7, you rather have 1.7 million that you're going to contribute to the project in cash. You managed during the last couple of years to get an ARPA capital grant, or you are pretty sure you'll be able to get a member item from your either local legislature or federal legislature if it's at least $600,000 that you will put towards the equipment and furniture budget. Then you've brought in a capital campaign consultant who feels pretty sure that you'll be able to raise $3 million from a capital campaign. So that subtotals 5.325 million, which leaves you a gap of 3.5 million. That's where you'd consider looking for debt. We fortunately said, looks like I can borrow between 4 and 5 million. So I'm in the ballpark here with 3.5. But as you'll see, we haven't taken into account the financing costs. What's it going to take for me to actually get that money from a lender? So next slide, please. So in this instance, we're now estimating, okay, what's the debt going to pay for and what's the cost of that debt? What goes into those financing costs is the lender will likely have a fee. They're going to charge you for borrowing that money. There are also going to be some costs associated with the different kinds of due diligence the lender will want to do to make sure that the collateral is applicable and meets their loan to value ratios that they have. So they'll likely do an appraisal. Now, this is applying very particularly to owned property. There may be a different solution if you're leasing property, but let's assume here you're buying the property. So there will be an appraisal. If the appraisal comes back and is successfully achieves the lender's loan to value, great. If it doesn't, you and the lender may need to consider other options. One of those is maybe you have other property that is not encumbered by a mortgage and another appraisal of that property, and that would get you to the loan to value. Or, as we've mentioned, other forms of security, perhaps a loan guarantee. So that appraisal is in here, the cost of that appraisal or more than one appraisal, doing an environmental assessment of the property, making sure there is no hazard. You would have wanted to do this in your own right. You probably would have wanted to do an appraisal to make sure you're getting the price you agree to with the seller is appropriate as well, and you're not being taken for all you're worth, if you will. But minimally, you want to know there are no hazards on that property. Otherwise, you're putting a health center in an area which has problems, perhaps an old gas tank that's leaking and produces an unhealthy environment for a health center. Not a good idea. The other costs that are in here are what's called title insurance, as an example, and there may be some other expenses that the lender will charge. That is for ensuring that the mortgage that they put on your property is defensible, if you will. And then finally, there are legal costs. You will pay for the lender's legal costs. You will pay for your own legal costs as well. Hopefully they're up here in the professional fees, but in any case. So now we're up to a loan that's more like $3.6 million because you will want to, if you can, borrow the costs of the financing. If you can't, you'll need to have another $115,000 of cash, and your loan will be 3.5 million net of those expenses. So now your project is around 8.9 million. So this is just a sample, but it gives you a way of thinking about, have I accounted for all my project costs? And have I taken into account all the potential sources? If you can't raise all that money and you want to get started, you may need to consider a higher loan, or you may need to see if you have additional cash. Again, where I mentioned flexibility in the loan is, let's say you raise 2.5 million, and let's say your lender is willing to lend you another 500,000. Having the flexibility as additional campaign pledges come in would allow you to pay down, say, that $500,000 when it comes in, and reduce your loan amount over time. So next slide, please. Again, we've just touched on all of this. start raising cash now in advance or as soon as you can while you're thinking about a project. Look at what all the possibilities are for raising money through grants from government and foundations. See if it's viable for a capital campaign. This does not work in every community. And then identify what your potential sources are for funding and whether there are loan guarantees that could help make that financing happen. Next slide, please. So in a quick way, what can PCDC do to help you? We like to say that we have money, and then we like to use that money to craft a solution that works for you. We can provide loans at any term in the development of the project, which means we can provide pre-construction loans to help you, afford your architect or afford to help you buy that site when as soon as you're ready and have reached an agreement with the seller, even if you're not won't be ready to start the project for a year or more. We can obviously help you during construction. And then we offer what's called the long-term loans, which is the permanent debt, the debt that you pay off over a period of time. Next slide, please. And now I think I will turn it back to Rachel to take us to the finish line. Thank you.
Thank you, Nancy. So that was a lot of great information, and I appreciate you walking us through that process. So we just want to remind you of some, tips and takeaways as you're thinking through this process. So first and foremost, we can't stress enough, begin the process in really assessment of community needs and understanding sort of your growth, anticipated growth over time, and what your organization and your community needs and as really the reason for pursuing the project. And then, of course, prepare yourself and your project for potentially taking on debt. We encourage you to think about improving your financial performance, setting aside cash reserves, and really maximizing revenue for capital uses and really surplus of revenue for capital purposes. And then to really think about exploring your financing options early. Don't wait till you get too far along in the process to think through what options may be available to you. As Nancy's touched on, there's a lot of different financing options available, some of which may be helpful to jumpstart your project and get you going. There's many different ways of crafting those loans. So thinking through those and researching those options early. And then, of course, to seek experienced consultants and lenders to get more information. Next slide. So we just want to remind you about our final session. If you've not yet registered, we encourage you to register. I'm dropping the link in the chat here. And we also have a QR code you can scan. So our final session will be on December 11th. And this is really where we will talk through the final phases of the capital project. And we will have a panel discussion with health center leaders who have gone through this process and can provide some, lessons learned and maybe valuable pitfalls to avoid, things to think about as you're going through this process. So it'll be a great session, and we encourage you to attend that as well. And next slide. So we have some time. If you have any questions, you can drop them in the chat. You can raise your hand, and we're happy to take you off mute. But since we have Nancy here, please feel free to take advantage of that now, or you can also reach out to us. Our contact information is on the slides, and we'll be sending the slides and the recording at the end of the session. So feel free to reach out if you have any questions. And you are welcome to ask them now as well.
Well, we'd also encourage you if you just want to make a comment about either a project you're working on, a difficulty you're having, a success you're having, we'd love for you to share that with the folks on the line as well. I guess one final thing is really to say that we also have a lot of resources on the PCDC website, examples of other projects as well. And we're happy to make connections to other health centers so that you can learn from your peers as well.
And actually, we do have one question that came through. So Ellen asked, once we entered the design phase, the project grew in square footage. Any guidance on how to handle that?
Well, yes, there are, and hopefully there'll be some of your peers at the next session who will also touch on this. It's really a point where you need to make a decision. It grew in size for a reason. It can be taken down in size with rationale. And that may be that you can't accomplish everything that you want to accomplish in that. You may want to focus on revenue producing space and you may have to take out, suppress some of the non-revenue producing space that you may contemplate having in there. Many organizations want to have space to allow the community to come in and use the facilities. You may have to make some sacrifices. So it's partly what's called value engineering, is making some hard decisions if you cannot afford that additional space. That's all predicated on, can you afford it? It sounds like you can't, or think you can't, or would rather not. So that's the time in which you have to make some hard decisions internally and involve everybody in the management team to make those decisions together. Not sure if I answered your question. If not, please expand.
Thank you, Ellen, for that question. Anyone else? We'd love to hear from you as you're thinking through this process and, wherever you are in the process. Yes, Ellen said, yes, thank you. Is there a way to analyze revenue versus non-revenue generating space?
Yeah, that's so I would say anything where you're encountering a patient and can have a billable visit is revenue producing space. So your exam, it's all of your clinical space, first of all, at a minimum. So where are you doing primary care? Whether that's adult, pediatrics, OBGYN, we consider that. Where are you doing behavioral health? Are you doing dental? Are you doing optometry? Do you have any specialty services? Are you providing lab services? Are you providing radiology services? So anywhere where you are touching a patient and producing a billable activity is revenue producing space. You might think about grant funded spaces as well, but those can be touchy unless you know those grants are continuous and sustainable, not just 1 year. If you got a 5-year grant, okay, you can feel better about it and you can feel your chances of renewal are pretty good, but you need to feel comfortable that you're going to have an ongoing source of revenue that's coming out of that space, even if it's reliant more on grant funding. If you're going to rent out that community space, it will produce revenue. The question is, how much, is that the best way you want to be seen in relation to your community? And how much can you charge? And how much is it going to be used? So, that's it. So what's non-revenue producing? All of your back office space, your IT, your staff related spaces, conference rooms, administrative space, the lunchroom, those are not revenue producing. They may be important to enable you to not only keep staff, but keep the space running. But again, if you put in a gym, unless you're actively doing physical therapy or know you're going to have ongoing physical therapy, physical fitness programs that people will pay for, maybe you shouldn't have a gym. So it's really up to you, but that's kind of a way to think about it. Again, did I get at what you were hoping to hear?
And Ellen, if you want to come off mute to ask, feel free to raise your hand, but those are great questions. We also got another question. At what point does one bring in a group to help determine our capacity for capital expansion? What is the cost of doing so?
I think it depends upon, right, what your own internal capabilities are. So many people do reach out to consultants to help them actually think about the needs assessment, but the needs assessment in terms of how might it really translate into program expansion for you, right? How do I think about, do I have enough dental exam rooms today? What's my backlog? What's the dental availability in the community? Will I be able to fill my dental exam rooms if I double the number I have? So that bringing in an external consultant can help you assess those opportunities. They can also, if you have this, not, I don't mean this to sound pejorative, but if you have a limited capability or time, because you're busy running a health center, to do those kinds of projections, they can help with them. You're essential still in making those projections. They cannot make them for you. You have to know that the assumptions that are behind them are workable for your organization, but they can help with the literal heavy lifting of making projections, and doing the modeling. The cost of that can be very variable. One other thing I did want to go back to on Ellen's question about revenue producing spaces. Every state is different in terms of reimbursement. And some states pay equally, whether it's a dental visit or an adult primary care visit. Some pay different rates for dental, behavioral health, and primary care. So understanding then which kinds of clinical services are going to be most profitable for you is an important consideration also in what you're going to put in a particular project. I know of a health center that decided they just didn't make enough on dental. They were not going to, even though there was a need, they were not going to expand their dental services because it was going to weigh down the organization. So they made a different choice. Going back to how much does it cost to bring in consultants is very variable. We can help you think about who you might go to. We have some, there are some go-tos that your peer organizations have gone to. You can ask your peers who they've used to see where it is that you might get help. And then what it will cost depends upon the extent of the services you need. That's the best I can do right now.
If you posted that question, you have any follow-up questions to that, feel free to type that in.
I'm sorry, just should answer. At what point? As early as you can, because the planning for obviously what you think you can do with the space or what kind of need there is in the community and how that need will translate into demand, patients walking through your doors, is really the foundation of the project you're going to build. So it's important if you need to bring in external help, that you bring them in as early as possible. Once you've decided, though, what is it that you want to focus on in your own strategic plan? Because if dental is exceedingly important for you, regardless of cost, it's fundamental for the health of your patients. We know a lot of conditions come out of untreated dental care. Then you may just want to do it in any case. So let me pause there.
Thank you, Nancy. So anonymous question has some further details. So I will type in an email address to reach out to. It's kind of a specific question to your organization. And we're coming to the end. So as you can see, all 3 of our emails are on the slide here. So you are welcome to reach out to any one of us with those questions, and we are happy to point you in the right direction on those specific questions. So thank you so much, everyone, for your participation and those questions, and we look forward to you joining us on our 3rd session.
Thank you all.
Thank you.
And thank you, Nancy.
How do we do?